Finasteride and its effect on PSA levels. A simple explanation. Let's dive into understanding a medicine called finasteride. It's like a superhero in the medical world, fighting against problems like an enlarged prostate, known as benign prostatic hyperplasia, BPH, and hair loss in men. What finasteride does best is blocking a hormone called dihydrotestosterone, DHT, which is responsible for making the prostate bigger. DHT also damages hair follicles and leads to male pattern baldness, or androgenic alopecia. When doctors want to check for prostate cancer, they look at something called PSA, prostate-specific antigen levels. But here's the catch. Finasteride can change PSA levels, making them lower. Let's break down some critical points. When making the prostate smaller, finasteride helps reduce DHT in the body. Less DHT means a smaller prostate, and a smaller prostate leads to lower PSA levels. Connecting with PSA, using finasteride means that PSA levels could drop by about half within 6 months to a year. 2. Handling PSA readings. Doctors, knowing what finasteride does, adjust the PSA readings a bit. They might double the value to get a clearer picture, while keeping in mind the effect of finasteride. These changes make sure that the PSA levels are accurate and helpful when checking for prostate cancer. 3. Understanding cancer detection better. Adjusting the PSA readings helps to keep the screening for prostate cancer effective and sensitive. 4. Thinking about biopsy. The new PSA levels help doctors decide whether a biopsy, taking a small tissue sample of the prostate, is necessary to look more closely for signs of cancer. So in simple words, finasteride is a helpful medication that brings changes in hormones and PSA levels. Understanding these changes and adjustments is key to getting the right picture of a person's prostate health. The critical element is that patients must inform doctors about the use of finasteride. Failing to do so can put one's health in jeopardy.